Well, hello there, friends and family. Now, I wish I had better news for you today. And I don't. And you may be aware and you may not. But now, the coronavirus has been declared a pandemic by the World Health Organization, known as the WHO. Now, what does that mean for all of us? Well, you probably saw some other developments today as well. It doesn't mean much in a word because it's far too late. This should have been declared a pandemic, as you know from my past videos, 4 to 6 weeks ago, when it had already spread through multiple countries around the globe. But now it is. And what I want to talk to you about is what that means to us, as far as global citizens, as well as us here in the U.S. Now, what we're looking at right here was where we were at the last time I talked to you, back on the 9th. And the U.S. had 603 cases. Worldwide, we had 113,432, with 3,994 deaths. And we all knew it wouldn't be long before the deaths were at 4,000. So, here we are today, Thursday, March the 12th. And this is now what the world looks like. And you can see quite a change. China, still the leader in number of confirmed cases. Europe is now the second in confirmed cases. The Middle East, third. And the U.S., unfortunately, being fourth. And you can see the spread as it spreads through also Central America, across all of South America. And probably, which is going to be the worst human disaster in modern time, it is now spreading throughout Africa. But what I want to talk about first is about what America may look like in just as little as a couple of weeks. And to do that, we have to look at Italy. Italy has 12,462 confirmed cases. 827 deaths. Now, as most of you know, a week or so back, Italy put up a health barrier and locked down their northern provinces. Well, as of just this past Tuesday, they decided to lock down the entire country. And it's been all over the media. Locked down the entire country. But did they really lock it down? And that's what I want you to take a look at now, because we're doing the same thing in America, making the same mistakes that Italy made. So let's look at what their lockdown really looks like. So here we are at Sky News, and this is an article. Coronavirus, how do you lock down an entire country like Italy? All outdoor gatherings have been canceled in Italy, and museums, theaters, cinemas are closed. Now, all of them have been canceled. They didn't put a minimum requirement as how many people. They've shut them all down. And that's a good thing. But, as we read down through it, it says right here, Italy's Prime Minister has placed the entire country in lockdown in an attempt to stop the spread of coronavirus. Giuseppe Conte said the strict measures would be extended to the whole country on Tuesday. Some 60 million people, after parts of northern Italy were shut down earlier. The measures, which described as I stay home, mean people will only be permitted to travel for work or family. Now understand this. The media's been telling us it's a lockdown. Italy's been telling Europe and the world it's a lockdown. Right here, what the man is saying is people are still allowed to travel for work. That's every day, back and forth from their homes, their communities, to their jobs, and family emergencies. That's not a lockdown. And that only means and can guarantee that the coronavirus will spread and continue to spread throughout Italy. And there is already some confusion over what Italian citizens will be allowed to do. But what do these measures mean for different aspects of life? Public transport. Mr. Conte said public transport would remain operational and airports and train stations would stay open. Therefore, people can still travel by train, by car, by plane, all across their country, and as far as I know, all throughout the European Union. So, lockdown isn't really a lockdown, is it? Tourists will be allowed to return home, but those departing and arriving on flights will have to justify their movements. Under the previous lockdown, affecting only the north, travelers at train stations had to sign a police form to say they were traveling for proven work needs, situations of necessity, health reasons, or to return home. People have had their temperatures checked at train stations. We all know that's ineffective because the average incubation period can be from 0 to 14 days, with outliers being as much as 24 to 27 days. All through that time, you can show no symptoms at all, one being a fever. Cars on the main roads, police have been checking whether drivers are complying with the movement restrictions. Cruise ships. At some ports, cruise ships have been forbidden to dock. Checks were earlier introduced for cruise ship passengers arriving in Venice who are not allowed to disembark to visit the city. Restaurants. Bars and restaurants are only permitted to open between 6 a.m. and 6 p.m. That's not a containment measure. They must be able to guarantee customers are at least 1 meter apart. Now, everything we've been told, I and all of you, I'm sure we know this. Social distancing is maintained 6 feet from the next person or people. Here, Italy's saying 3 feet. 3 feet. Our CDC even is telling us 6 feet. Businesses will be closed if they do not adhere to the rules. Shops can remain open if they are able to guarantee the 1 meter safety distance for customers. Here again, that's half of what's recommended by the CDC and even the World Health Organization. Food stores are allowed to remain open at all hours. On Monday evening, Sky News Italia reported many people had rushed to the supermarkets across Italy following the Prime Minister's announcement. Large and medium-sized shopping centers and markets have been told to close at the weekends. All sport events and competitions have been canceled until the 3rd of April at the earliest. This includes Series A football matches. Mr. Conte also said gyms will be closed. Schools and universities will be closed until the 3rd of April. Some schools in the north and center of Italy have been closed and expected to reopen on the 16th of March, but the closures have now been extended. Social gatherings. All outdoor gatherings have been banned, and events including religious activities, fairs, and sports are suspended. Pope Francis celebrating morning mass by himself in the chapel, the Vatican Hotel where he lives. The mass live streamed instead. Mr. Conte also warned young people should not gather at pubs and bars, saying, "We cannot allow ourselves any more these occasions of meeting, which become occasions of contagion." All weddings have been suspended till the 3rd of April. Leisure activities. Across Italy, museums and archaeological sites have been closed. Ski lifts also been closed after students whose classes were canceled began booking trips to ski resorts. Cinemas and theaters have shut too. Prisons. All visitors to prisons have been suspended, and as you might know, they've been having prison riots. The health sector. People who accompany patients to A&E units are not allowed to stay with them in the waiting rooms without permission. Leave for healthcare workers has been canceled. So that's the current situation in Italy, and the reason I wanted to go through this, they keep saying this is a lockdown. Well, you can still come and go for work every day and for family emergencies. The bars and clubs and pubs are open. You can still travel in your car, by train and plane. So I don't see how this is doing anything to contain this virus. Like some other things we'll be discussing in this video, this is nothing more than a way for their prime minister to say, see, we're doing something, but it will have absolutely no effect. And it has been having no effect since Tuesday. And why is this so important to us? It's here, like I said again, the U.S. is doing some of the same, but much less. But what I want to show you next is also the future of America, because we're only 2 weeks behind Italy, our health officials say. Let me show you the reality of the coronavirus in Italy. So here we're at an article from Business Insider, and there's many just like it. This is just the one that popped up in my news feed, and I chose it. And what it says right here in the headline: faced with tough choices, Italy is prioritizing young COVID-19 patients over the elderly. Then it says that likely would not fly in the U.S. Well, I beg to differ, because if things get extremely bad as they are now in Italy, which its entire hospital system is on the verge of collapse. But let's read through the article. Epidemics force medical professionals to make tough choices, including which lives to save first. In Italy, where more than 9,000 people have been diagnosed, and we all know now it's 12,000, COVID-19 doctors are prioritizing the young and otherwise healthy patients over older people who are less likely to recover. An NYC medical ethicist told Insider the medical community in the U.S. would also have to make decisions about who to prioritize if hospitals become overwhelmed. Choosing patients simply based on their age, however, would not fly, he said. With the number of coronavirus patients rising every day, the medical community in New York City is discussing what to do if hospitals in the U.S. become overwhelmed. In Italy, where more than 9,000 people have been diagnosed with COVID-19, doctors are scrambling to secure resources and treat patients. They have been forced to prioritize the young and otherwise healthy. It's very hard to just prioritize the young over the old. That would not fly in the U.S., Arthur Chaplin, the head of the Division of Medical Ethics at NYU School of Medicine in New York, told the Business Insider. People would protest the idea that young lives are worth more inherently than older ones. Do you really think so, people? Remember what many are saying here in the U.S. Chaplain said hospitals like NYU's Bellevue Hospital have already been discussing how to ration scarce resources if need be. While there hasn't been a hospital committee meeting that addressed which patients will get priority in treatment, he expects that to come up down the line. These conversations, which will likely vary by hospital region, should touch on just the age of patients and a number of other factors, Chaplin said. If you had, let's say, an ICU that was overwhelmed, you're probably going to try and give some extra attention to healthcare workers because you need them to deliver care, he said. The rationale isn't that they're more worthy, it's that they can contribute in the longer run to saving more lives. When a medical center discharges a coronavirus patient, it would make sense for healthcare workers to consider whether the person is homeless before doing so, he said, because they might not have somewhere to safely self-quarantine and recover. In a crisis, hospitals try to maximize the chance of saving a life and make sure that we save the most years of life, Chaplin said. And that way, younger people tend to have a huge priority, but not exclusively, Chaplin said. In fact, most people who are young with coronavirus won't even be treated in U.S. hospitals because they will likely recover at home. So what we're talking about is very sick young versus the sick elderly, who we know aren't likely to do well, he said. It's not like every young person is going to get ahead of every old person. The coronavirus is far from the first time that hospital workers have had to grapple with which patients to treat at the expense of others. In New York, there are guidelines on how to allocate ventilators during a flu pandemic, Chaplin said. You see, they've already made plans. They suggest that you may take someone who's desperately ill and not likely to live off that ventilator and put someone else with a much better chance on, Chaplin said. I'm not against that, but I will tell you that doctors hate to do that because they don't want to abandon their patient. That is a topic that will likely also have to be addressed when hospital committees meet to come up with coronavirus policies. While it's important to have the conversations about how to ration resources, Chaplin is concerned that not enough people are thinking about how to share resources among institutions. I've been complaining that we need a strategy for sharing. So if NYU Bellevue got overwhelmed, how do we direct patients to other hospitals in New York City or the VA, he said. You need to be thinking about that right now because the better solution to shortage is sharing, not rationing. And that would make some sense, folks, if we don't already know, because it's already happening in Italy. Italy's entire hospital structure is maxed out. And like I said, based on what their own prime minister and health officials said, it's on the verge of total collapse. But the point was that I wanted to bring this up was Italy right now is having to make some very hard decisions of who gets treatment, who gets a ventilator, who gets an ICU bed, who gets an acute care bed, and they're doing it based off age and survivability. And what do I mean by that? Well, let's say, take somebody like me. I'm 64 years old. I have underlying health conditions. I have COPD. I have emphysema. I have high blood pressure. Do you think I'm going to be one of the ones that when it comes time to decide if a healthcare worker needs that bed and that ventilator, or a younger person needs it, if they'll keep me on it? I'm not fooling myself, folks. I don't believe that. And as your age goes up, say you're in your 70s or your 80s, will you even be able to be treated? Or will you be one of the ones left out in the tent, in the parking lot, to die? That could be an extremely real reality for many elderly Americans, just like it's happening right now today in Italy. It happened during the Spanish flu, people. You can look it up. You can look at all the tent wards, everything that they had to do to try to care for so many people that were sick and dying. But now, I want to look at just what we have available for hospitals and beds here in the U.S. Because I think that's an extremely important number to know, don't you? So I hope now, folks, that you understand the situation in Italy, what they have or haven't done, how effective it will be, and the very extremely hard decisions they're having to make now daily as far as care and who gets it. And I want you to think about it. When it becomes that time, which I believe will be in the next 2, possibly 3 weeks at the max here in the U.S. But more so, something they didn't cover, and I want to go over, and what I really believe will be the situation in the U.S., is who will be the first to be treated and who will be the first people to be allocated ICU beds, ventilators, and treatment in our hospitals across the country. Well, as you might suspect, that's going to be our elected officials. That's the president, members of the Senate and Congress, their staff, their family, and their loved ones. You'll watch it happen. Second, it'll be the wealthiest among us, because they can afford to pay the cost. And thirdly, it will also be our state governors and elected officials, as well as city, county, and all their families and loved ones, and on down the list. We, just your average plain American, will be. We will be last in line, far down the list from all of them. You can take that to the bank. You can write it down, stick it on the fridge, so you remember old Mr. Tom told you so. But where we're at now is the Society of Critical Care Medicine, Intensive Care Professionals. And the reason I brought you here is to show you just what lies ahead and just where our hospital system is right now. Now where we're at in this, on this same page, is intensive care unit facilities. And you can read it, and I'll leave a link to this, as I always do for all the resources I use in making this video, because it goes through a lot of different aspects. But what I'm most concerned with and what I want you to know is what's out there available right now to treat all of America. And this is intensive care facilities, and this information and data comes from the American Hospital Association and Hospital Statistics Systems and the U.S. Centers for Medicare and Medicaid Services Healthcare Cost Report information. AHA data, like I said, that's the American Hospital Association. According to AHA 2015 annual survey, the United States had 4,862 acute care registered hospitals. 2,814 of these had at least 10 acute care beds and at least one ICU bed. These hospitals had a total of 540,668 staff beds, and this is the important part, 94,837 ICU beds. So let's take a look at the intensive care beds in total, like it says here. Out of the 540,668 staff beds, there's only 94,837 ICU beds for the entirety of the U.S. Current estimated population of the U.S. is 330 million people. So that's not very many ICU beds to be had. Now, late last night, a congressional doctor briefed the Congress and White House that he felt up to 70 million to as high as 150 million Americans would be infected by the coronavirus before it was all over. Think about that. 70 to 150 million. Now, what the government says is 80% of them won't even have to be hospitalized. They'll either have minor to no symptoms. Well, I sure hope that's true, but let's just take a look at the other 20% that will have to be hospitalized and what that looks like. So let's just take the low end of what the congressional doctor advised Congress and the White House last night, of 70 million minimum being infected by the coronavirus. And we're going to multiply that by 20%. That's 14 million people out of that 70 million that will require hospitalization. Now understand, total beds in our hospitals 540,668. Also understand, if you watched my last video, Dr. Redfield, director of the CDC, said 95 to 96% capacity right now because of the near epidemic level of seasonal flu in the U.S. So, if that congressional doctor's estimate, even on the minimum side of 70 million, and 20% of them required hospitalization, What are we going to do with 14 million people? Can you answer that? Because I can't. And if what he advised Congress of last night is true, this even makes the Spanish flu look like a walk in the park. And that was the very reason I wanted to go over the situation with Italy with you. I wanted to go over the hard decisions they're having to make. Is who will get treatment first, who will get treatment second, and so on. And who may not even get treatment. They just may be sent home to die. That's the reality Italy's facing right now. And that could well be our reality in the coming weeks. Because we have yet to take the measures that need to be put in place to even try to contain this virus. So now, y'all, I'd like to share with you 2 videos. And each of them show both ends of the spectrum of who can be infected by the coronavirus and who is being currently treated for coronavirus in our hospitals. And the first one, and I hope you will watch it, as I do hope you'll watch the second. This video right here is the first New Jersey coronavirus patient to be treated. And this young man is James Key, a 32-year-old that never smoked and had no underlying health issues. He works as a physician's assistant, but he did not contract coronavirus at work. He was infected while attending a medical conference at Times Square Hotel. He is now being treated at the Hackensack University Medical Center and is in isolation. He is worried about his recovery and said the symptoms came on suddenly. He said just in case he does not make it through this, he hopes his wife and child can come see him a last few times. So this is just one of those people we were talking about earlier. And if you listen to our government, they say the young will have at the very least mild symptoms and won't require hospitalization at all. But this young man, 32 years old, has a wife and a child, is now in the hospital in isolation fighting for his life. And like I said, I hope you'll watch it. But he is a healthcare professional. He is young. And when it comes down the line, later on in all this, and I'm not saying he doesn't deserve to be in there. And thankfully for him right now, our hospital system is not overwhelmed. But he would be one that we were talking about that would be one of the top priorities for getting treatment. But then what I want to show you is another individual who's on the opposite end of the spectrum, that's infected and also hospitalized right now. So now where we are, here's another video. And this is a man, George man. This is Clay Bentley. And he's currently being treated at Emory Hospital outside Rome, Georgia. And his circumstances are different from the young man we just looked at. First of all, Clay here is not young. He is a retired law enforcement officer. And when he went to the hospital, he went in, he was very sick. They went ahead and asked him, had he been traveling? Had he been to China? They went through all of that. He said no. They went ahead and tested him for influenza. He came back negative. So, they sent him home. After a few more days, Clay here got worse. So he called back up the hospital. And he told them he was way worse. And that he felt like he was sent home to die. It was at that point they went ahead and told him to come in. And now, he's sitting in the hospital, Emory, in quarantine. In very, bad shape. Now, like I said, he's on the other end. He's an older senior gentleman. His wife, which is a flight attendant, but does not work on international flights, she works on flights up and down the East Coast, still does not have the coronavirus. So Clay here has no idea how he contracted the coronavirus. But this is what I'm trying to show you. What our government is telling us and what the reality is. On the one hand, our government says the young will most likely only suffer minor symptoms to maybe none at all. But I showed you that with James Kai. That's not the case. And then here we have a senior gentleman fighting for his life that was turned away. And you got to understand what we have learned from China and what they have told the world. The sooner you recognize that a patient has the coronavirus, which requires testing, which we in America still don't have up and going very well, but the sooner they can get treatment, the better off their prognosis is for recovery. And poor Clay here, he was sent home. And I don't blame him. I don't blame him for feeling that he was sent home to die. Because at some point in time in this crisis, that may be truer than he knows. But for him now, he's getting treatment. And he feels he's getting better. And I hope you'll watch this video. Because I think both of these videos show you the young end of it and the possibility that yes indeed the young can be infected. Yes indeed they can have severe symptoms and require isolation and treatment in a hospital. As we all know, the government tells us most of the time the coronavirus is impacting the elderly. Well, I don't think Clay here is in his 70s or 80s. If I had to guess, early 60s. And that's where my age group falls into line. So it's very concerning to me. But now I want to switch gears and let's just take a hard look at where America stands right now on Thursday, March the 12th. What we have done, what we're not willing to do, and will we make the hard decisions necessary to bring this coronavirus under containment. Now here we are back at what the USA looks like today, March the 12th. Now you're going to see a big difference on this here map. And this is from the same site I've always used, Johns Hopkins Hospital site. But one of the big changes you notice right now is they're only tracking coronavirus now, not by county like they were Monday when we last spoke. But over Monday night they changed it. And they changed it to only tracking the number of cases by state. I was quite upset and really horrified. Because I think many of you were using the Johns Hopkins website here to track how close the coronavirus was not only coming to us in our state, but coming to us in our homes. And you could do that somewhat when they were tracking it by county. Why they switched to state, I don't have an idea. I just can't fathom why they would do that. Now, all we can do is rely on our state public health officials, our county health officials, city health officials, and letting us know when a case is in our area. And as we're seeing in some states, the states are not releasing the information as to the locality. They're just reporting by state. And that, in my opinion, puts everybody in danger. But it is what it is here in the U.S., where many times truth and transparency isn't a part of the plan. But I want to show you a different map real quick because it shows the picture much clearer. So here we are, and this is just another map for COVID-19. And you can see clearly now where it's at as far as states. and where it's not. Now, I will say this, since this map was published earlier this morning, Montana now has confirmed cases. So that's, Hawaii has had confirmed cases. So now, the only states without confirmed cases are Alaska, Idaho, Alabama, West Virginia, and Maine. 45 states have it. But I've been watching some of the House committee hearings today. They talk about 30, 35, and it's the same way all over our government. They aren't even operating off the current information that a little old country engineer in South Alabama can keep up with. It just astounds me. But this gives you an idea of just now how widespread it is across your area or in your state. Where we're at now, this was held yesterday in the House of Representatives during one of their committee meetings. And this is where expert Dr. Fauci, CDC Director Dr. Redfield were testifying before Congress. And Dr. Fauci here explains just where we're at and what the situation was. And he was being grilled, and so was Dr. Redfield. And the Congressman Grothman asked him if he could predict or tell us how many people in America would be infected. And let me just say this. Dr. Fauci, the director of the National Institute of Allergy and Infectious Diseases, he responded, "Things will get worse. How much worse? It will get depends on two things," he said. One, containing the influx of infected people coming from other countries. Two, containing local outbreaks within the U.S. When pressed by lawmakers for an estimate of eventual fatalities in the U.S., Fauci said it will be totally dependent on how we respond to it. Dr. Fauci continued, "I can't give you a number," he said. "I can't give you a realistic number until we put into the factor of how we respond. If we're complacent and don't do really aggressive containment and mitigation, the number could go way up and be involved in many, many millions of Americans." Now let that sink in. Here is the top expert in America from the National Institute of Allergy and Infectious Disease. He's worked under 6 different presidents. He's very well respected. And he's telling Congress, and I'm sure he's told the White House, that one, we got to stop the influx of people that could possibly be infected with coronavirus from coming into this country. 2, we've got to take very aggressive containment measures. And it's both of those we have yet to do at this moment. And I'm not sure we're willing to do, because we haven't done it yet. So what aggressive measures are we taking in the U.S. for containment? Well, let's just take Washington State, which now has the most confirmed cases as well as the most deaths. And this is Governor Jay Inslee in this video. And what he did was he put out a proclamation, and he is limiting large gatherings. Not all large gatherings, just large gatherings over 250 people. Now how insane is that? That's like saying 250 less won't contribute to the spread. Do our government officials not understand it all started with one person in Wuhan, China? It all started with just one infected person in each state in the U.S. It's insane to allow any large gatherings to continue, whether they're 50 people, 250, or 25,000. We have to make hard decisions, just like Italy has done, albeit so late, to ban all gatherings, period. But then we have another state. We have the state of New York. And let's take a look at what they've done. Now, I would also like to add, Governor Inslee also closed the schools in the Seattle area. So that's going to help. We all know, though, there's been no deaths in children from 0 to 9 years. Now, that being said, that doesn't mean they can not be infected, and they cannot transmit the disease, because it's been proven they can. And it's a good idea, because as far as my concern, every school is a large gathering. People are close together, and sometimes overcrowded classrooms. But here again, looking at the case numbers in Washington State, looking at the amount of deaths, both banning large gatherings over 250 and closing the schools is a little too little, far too late. But let's travel over to New York State, because they made a big announcement a couple of days ago. They enacted a containment area. Now here we are in New Rochelle, New York State. We went from the West Coast to the East Coast. And Governor Cuomo, a couple of days ago, came on in a press conference and announced he was enacting a 1-mile radius circle around New Rochelle as a containment area. And that sounds really good, doesn't it? But then he also went on to say it wasn't a quarantine. People can still come and go whenever they need to for work or whatever. But he was having the National Guard come in. And a lot of people thought that National Guard was being placed, and they made such a big issue of it that they were going to enforce the containment. No, they aren't, because there really isn't any containment. What his containment zone comprises of is to ban all large gatherings. That's a good thing. They've closed all the schools. That's a good thing. But allowing businesses, shops, companies to continue to operate, as well as allowing people to leave the containment zone to work in other parts of New York State, to New York City primarily, and then to return to their homes, is just a recipe for continued spread and disaster. Here again, neither of these governors made a sound decision or made a hard decision to contain the coronavirus. It's really nothing more than political stunts. It's just another way, just like Italy's prime minister, of saying, see, we're doing something. But the something we're doing isn't going to work. Trust me, it's not. And just like in Italy, Governor Inslee's proposals of banning large gatherings over 250, closing down the schools, as of yet don't have any difference in the rise of infectious cases of coronavirus in Washington State. And then Governor Cuomo's, his containment area, has done nothing to stem the tide of the growth of coronavirus cases in New Rochelle. They continue to climb. And New York has the second largest number of confirmed corona cases in America. And this is what I'm getting to. We have to make the hard decisions. But as most of you know, our president came on national TV last night at 8 o'clock Central, 9 o'clock Eastern Time. It was my hope then that he was going to announce a national emergency. He fell a little short. But let's discuss what he did do. So what did our president say? I'm sure you watched it like I did. And what he first said was that starting this Friday, the U.S. was banning travel from Europe for the next 30 days. Now what we know about that travel ban today is that it does not include American citizens or green card holders. They can travel back after Friday. It does not include banning travel to the UK or Ireland, and some say many other countries. But it does ban travel for 26 European countries. He went on to say that he'd also talked with insurance companies and had them agree to drop the co-payments for coronavirus testing and to include treatment of the coronavirus in their policies. And finally, he spoke of providing loans by the Small Business Administration to small businesses in America to help them compensate with the costs of dealing and surviving the coronavirus outbreak here in the U.S. Now, all three of these things are good things. But the travel ban is way too late. And even with it, it has far too many holes in it. Then why aren't we banning travel from the Middle East, which is another hot spot, third behind Europe? Or for that matter, Africa, South America, Central America, Mexico. It's just like Dr. Fauci said. He can't give an estimate on how many will be infected in America or how many will die if we don't take aggressive containment measures now. And as of today, whether it's governors in states, the President of the United States, or Congress, we have yet to do that. And that's going to lead to a blow-up of coronavirus cases across America. It's like I said in my previous video, we're going to make what happened in China look like a walk in the park. It's going to be one of those, you got coronavirus problems? America, here, hold my beer. Let's show you how it's done. And that is sad. It's going to cause a lot of suffering and a lot of death. There's no way around it at this point in time, because we are failing to make hard decisions that must be made. And I'll say this, whenever we talk about the government, whenever we talk about the government enacting quarantines, you get all the people jumping out from the corners and from the darkest basements. Can't do that. This is America. We have rights and freedoms. I want to tell you one thing, Americans. I want to tell you what a virus doesn't respect, and that's your rights and freedoms. It doesn't respect borders, doesn't respect political beliefs, religious beliefs, gender. It knows none of that. All the virus knows is its will to survive. And to do that, it must continue infecting people to survive. And that's where we're at right now in America. And that is what has got me so worried. Not so much for myself, but for my daughter, who has a serious heart issue. My grandson, which in and of his own self has reoccurring health issues. But then it's for all of you out there that I've read in the comments, how concerned you are for your elderly mothers, fathers, grandparents, and great-grandparents, your children that have underlying health issues. You may have them, your husbands may have them, or other friends and loved ones. We have to start making the hard decisions in America, not only by our government, but we as American citizens got to be willing to make the hard decisions too. Now, I want you to understand, I'm not bashing the president. I'm not bashing Governor Inslee or Governor Cuomo. They've got to do something. They've also got to create a balance. They've got to balance what they're trying to do between preserving the economy, not only of the U.S., but of their individual states. because that right there can become even far greater of a disaster in the long term than just the suffering and deaths in America. But my point is, at some point in time, whether we do it now and possibly limit the suffering and death, or we wait till later and are forced to do it, we're gonna have to do it. And I understand these gentlemen are politicians, and they walk a fine line, and I wouldn't want to be in any of their three shoes or any congressmen's or governors during this pandemic crisis that has descended upon America. I've often been asked to run for political office, even here in my own state of Alabama. I've declined every time. I wouldn't make a good politician, because first, I'm a realist. And second of all, I believe in truth above all things, and I've never sold my integrity for nothing. And it's cost me dearly at times, not only in private industry, but with the government and the military. But I'm a true believer, and you've got to stand up for what's right. And I've had to make those hard decisions before. Not in a political elected office, but where it counted. In everyday real life, when people's lives were not only on the line, but they were in my hands. And with that, I want to share with you a moment that I shared with a viewer that made a comment in my last video. It popped up around 3:30 this morning. Yes, I wasn't asleep. It's been hard sleeping here of late. I'm wrought with worry, not for myself or my survival, but for that of my children, my family, my friends, my loved ones, and all of you out there. I wouldn't want to see a one of you have to suffer and die from this. And I hope none of you do. And Lord knows, I'll be praying you don't. But let me share this moment that touched me deeply this morning with you now. So as I said, the moment I shared this morning in the wee hours this morning came from a viewer from my previous video. And she wrote in the comments, and her name's Tamala Roberts, and I hope I pronounced that right. And she wrote a lengthy comment about the situation she's having with her youngest son and her middle son, the health issues they have, and the problems she's facing with them in school. And as I read her comment, which like I said was quite lengthy, I won't lie. Now I'm a hard-ass man, ain't no doubt. But it brought my eyes full of tears. And as I read, it really hit me in the gut. Not only for her and her children, but it reminded me what was at stake with my daughter, my grandson, my other son and daughter. Now, whether I survive or not is not my main issue. It's my children's and grandsons' survival that matters to me most, and that's why I've done everything I've done. But my heart goes out to Tamala. It goes out to her two sons and her family. And I'd just like to share with you right now what I wrote back as a response to her comment. And this is what I told Tamala in the wee hours of this morning. I do understand your situation, for my own grandson is autistic and has reoccurring health issues too. My daughter homeschools him for these very reasons now. It is because of my grandson as well as my daughter, who has a serious heart problem, that I have taken the actions I did. You see, I understand. I have lived my life. But for my daughter and grandson, they have not yet fully lived their lives. All I do here at my home is to prepare, not for me as it is, for them. I may not make it through this, but with what I've done and put in place, they may have a chance in surviving this virus yet. My daughter knows she can come back home with my grandson at any time she chooses. The same for my son. In the case I do not survive, what is here will keep them safe for a very long time. It's all I can do. I can only hope and pray it will be enough. As I think of you and your children, as well as my children and grandson, my eyes are filled with tears now. I'm at a loss to know what more I can do. My job as a father was to provide and protect for them, and now I am unsure if I will be around to do that, and if what I leave them will be enough so they can survive. I've done the best I could to factually inform others in hopes they will see what comes and make preparations. But I fear that far too many people have not listened and are in for a very hard awakening. I am a man of great faith, for I have seen the power of faith in some of the worst situations mankind has faced in the past. I've seen far too much death in my past and in my younger days. I have felt the blood of fallen comrades on my body, held them as they faded away. So many Americans have not had to feel this, and with that can never understand the loss of a loved one, a friend, or the one that moments before fought at your side. But for those that have suffered the loss of a child, a family member, or a loved one, they know exactly what I speak of. You can never forget it, or will never be able to let it go. It haunts you for all the days that you live. My only wish is that I could do more for you and your children, as well as all the peoples that will suffer and die as this spreads, not only here in America, but throughout the world. Now I can only pray for you and your children and all the rest. I do hope the whole of mankind will join together in prayer for each and every one of us as we go through this pandemic. Please take care, stay safe, make the decisions you must to protect you and your children, and may God bless you, your children, and all of humanity in this trying time. And even now as I read this, you can hear the trembling in my voice. You can't see how misty-eyed I am. But I love my country. I love my daughter, my son, my grandson, my family, my friends, as I love all of you out there. And if there was anything in my power, if I had the money, there would be nothing I wouldn't stop at doing. But I have done all I can as this descends upon us. Now, my only hopes is I've done enough. Now, I must pray and leave it in God's hands. So, what is left? What more can we do? And I know each one of you out there, your situation differs, both in your age, in your underlying health conditions if you have them, your work situation, your home situation, and the situation with your children. All of those things will determine what more you can do. And let's just take the case of working. And I'm so glad I'm retired right now. Thank God for that. Because see, for me, I can self-isolate on my property and at my home. And I'm ready to do that at any given moment right now. But I do understand for many of you, you have to work. You have to go out and make a living. But I hope you will do the things you need to do to protect yourself. Learn to not touch your face. Learn to wash your hands for 20 or more seconds. I know it seems so simple, and I know all of our government officials, health officials have said it, but it's something that must be a must. If you can't do that, use the proper hand sanitizer, or better yet, do as I do Get you some Clorox wipes. Hopefully you have them. And keep those hands clean. And when you get in your car, wipe down everything you've touched. When you come home, everything you touch before you wash your hands or you sanitize them with a Clorox wipe, wipe them all down. Take your shoes off outside. Leave them on the front porch if you have to. Or leave them in your vehicle and put on a pair of slippers and come on into the house. And I know for many of y'all, it won't make much of a difference because you're working in jobs where you're in close contact with people. People out there that are in retail. People who work in restaurants, fast food, transportation, who are working in plants right beside another, or first responders, or all the healthcare workers that are even far more exposed because they're the ones working closely with the coronavirus patients every minute of every hour of every day. But all you can do is take the precautions to keep it from infecting you. Build up your immune system by all means. And I will be doing a video shortly by the end of this week on what I do. Now, I'm not saying it's the ultimate, and I'm not saying it's the best. I'm saying it's what I do based on studying herbs and Eastern medicine since 1989. And I'm going to share that with you. Right now, I would suggest, if you can afford to, really supplement your diet with fresh fruits, fresh vegetables, as much as you can afford, and while they're available, and while you're still able to go out. Get outside in the sunshine. I am so blessed today that here on my little piece of earth, it's 84 degrees and bright sunshine. And I've been out a little bit today just to get out of the house and get away from this all and clear my mind. For those of you who have to face the issue of child care because the schools are closing, as of me speaking to you now, over 100 colleges and universities have discontinued the semester. They've told students not to come back from spring break. It's over for the year. Schools in Washington State closing, schools in New York State closing, and I'm sure that's just the beginning. And those of you parents who have to work have to come up with child care. And that may be an issue, and you may have no choice but to go home and be with your children. I am really hoping our government addresses the issue of lost pay by those who are quarantined or sick from this virus, as well as address those who have to stay away from work to care for their children. These are real issues that our government needs to address. Our government needs to get the testing out and start getting it done. We also need to give whatever resources are necessary to the companies that are working on not only the vaccines, but the treatments, such as the development, testing, and distribution and manufacture of remdesivir, the only medication so far that shows promise of working and is now in test in 2 places in America. And then, I hope our government can put politics aside. Let them go for once. And like I said today, I've been watching House committee meetings, and I just want to reach into the screen and shake these people and say, stop it. This is not the time for politics. It's not the time for pandering. It's not the time for accusations. It's the time for all of our politicians on a city, county, state, and federal level to take off the ties, slip off the suit jackets, roll up their sleeves, sit up straight in their chairs, and get to work and come up with a plan to save Americans. If I could be president right now, by God, I'd make sure that took place. So other than that, folks, all you can do is, especially for those of us elderly, it's just like the CDC now recommends. If you're 60 and older, you need to be staying at home. If you have underlying health conditions, you need to be staying at home. With that said, they advise to stock up on food and medicines. Now, I've got the food covered, but like many of you, I'm sure, the medicine part is a whole different issue in itself. I take blood pressure medicine. I have 82 days and counting. Now, I take another medicine for my COPD, and I have less than 30. Now, tomorrow I will be contacting my pharmacy and my doctor in an event to try to get enough of these for 6 months. So far, I've been unsuccessful. But tomorrow I'm going to approach it from a different angle. I'm just going to tell them flat out, piss on the insurance, I'll just pay. Because you know what the problem is? It's not that they won't give me the medicine. It's because the insurance won't approve it ahead of time. So tomorrow, and I know it's going to be costly, I'm going to make the decision, if that's the only way I can get it, to buy it outright. And I'll tell you right now, I'm not a wealthy man. I live on a fixed income. It's less than half of what I made when I was working. Now that granted, I know that's more than so many of you out there. And I have a meager savings, and it's not much. And I've dipped into that savings pretty hard the last 2 months. Because the truth was, never in all my life would I have ever thought we would have something like this descend upon us. I've always been prepared, but I've been prepared for things such as a job loss when I was working, an accident that would make it where I was unable to work, a tornado or a hurricane, a flood, an earthquake, or what have you. Not a worldwide pandemic. I missed that one. Maybe I should have. But this comes to the simple fact of how long, for those of us with underlying health conditions, those of us that are elderly and seniors, how long will we have to self-isolate? Is that going to be for 2 months, 3? Worst case, is that going to be till some type of treatment or a vaccine comes to bear? Well, right now, Dr. Fauci and the experts say a treatment may be approved now in 6 months to a year. A vaccine, a year to 18 months. And that's a long time to stay at the house. And I'll run out of many things. But thankfully for me, and I know like many of y'all my age and older, we grew up in a time when we didn't have near as much as we do now. And we also grew up in a time when you didn't have, you did without, and life went on. There have been times in my life when all I've had is some white bread and some gravy. Other times, some rice and tuna, or pork and beans. I have lived it. And if that's what I got to do now, I'll live it again. I am going to be starting my gardens. I am more than knowledgeable of foraging, and I could hunt if I had to. And that's what I want you to think about over the next day or 2 or 3. Think about, sit down with your husband your children, your family. And think about what more you can do, what you can do if this carries on for 3 months, 6 months, or heaven forbid, 1 year. And maybe in the comments below this video, y'all will share what you're going to do, how you planned going forward. Because see, in the end, that's what makes these videos so much more than just a video. It's all of you who watch it, and the community that follows the channel and me. It's what you share and what you bring below each video. And it's only because that 95 to 98% of you have supportive, concerned comments, sharing ideas in your own concerns and your own situations, that it overcomes the 5% that are just outright hateful, vicious, and malicious comments meant to hurt, tear people down, and attack me personally. I know they'd never do it to my face, but they can do it hiding behind the screen. But it's because of the 95% that I continue on to make videos, and I will continue on. And the videos that are coming are about what I'm doing here in my home, in my little small piece of God's green earth. And what I want to leave all of y'all with today, I want to express to you, especially those of us who are elderly and seniors, if you got the time, take that time to reach out to your local elected officials, demand from them, what's the plan? What are we going to do? How are we going to take care of the issues, protect Americans to get us through this? For the rest of you out there, I want you to know, all of y'all that watch the videos, follow my channel, that you're all in my prayers each and every night. And I do read all your comments, even the hurtful ones. So with that said, folks, until I see you on the next video, I want you all to take care, and I mean all of this. Stay safe. Keep your distances. Limit your exposure in public as much as humanly possible. Don't take risks that you don't need to. If you run out of chocolate, life goes on. Make the preparations you must to protect and safeguard your families. And as always, I do hope God blesses each and every one of you, your families, and your loved ones. So y'all, for now, I bid you goodbye till I see you again. Thank you for watching.